Hello, everyone. Today, let's talk about gestational diabetes. Did you know that many women around the world, millions of women around the world, develop diabetes during pregnancy? This is what we call gestational diabetes. I'm just going to give you a brief of what is it, what causes it, and how it can be managed. Stay tuned and let's dive deeper into it. This is going to help you, it's going to help your spouse, it's going to help somebody around you. Let's start now. So, gestational diabetes is diabetes that develops during pregnancy. So what happens is that the pregnancy hormones, during pregnancy, there is a lot of hormones produced by the body. And this affects how your insulin works on your food that you eat. So the carbohydrates that you eat from your starchy foods, from your bread, from your tea, your burger, your tubers, everything that you eat, these carbohydrates, when you eat them, they goes into the body, they break down into the small forms that we call sugars. Now we need the energy from these sugars to help you to do whatever you want to do. And before this energy can be utilized, we need the insulin. The body produces insulin, and this insulin is affected by pregnancy hormones. So the insulins are not able to work on the carbohydrate, and this is specific during pregnancy. When it affects you only during pregnancy, that is what we call gestational diabetes. So you may be fine, you may never have had diabetes before, but when you are pregnant, you can become diabetic and it can affect you and affect your baby as well. What are some of the risk factors that will predispose somebody to having gestational diabetes? So the first risk factor, we are talking of obesity or overweight. Then the second tip, we are talking of family history. There are people that in their families they have diabetes, and then or gestational diabetes. It only develops during pregnancy, and it can also happen. We have women over 25 years. When you are over 25 years and then you are pregnant, it is likely that you could have gestational diabetes. And we have certain disease conditions like polycystic disease. These are also other conditions that affect people and can predispose them to getting diabetes. What are some of the signs of gestational diabetes and when does it develop? So we are talking of the second to third trimester. So when you are pregnant and we have first trimester, second trimester, so 24 to 28 weeks, around that period. Pregnancy goes up to 36 to 40 weeks. So during 24 to 30 to 28 weeks, then you can develop this gestational diabetes. So you go to the hospitals and they check your blood sugar, and the blood sugar is higher than the normal ones. And it's only so because you are pregnant. That is what we are talking about. So from your second trimester to the third trimester, that is what this happens. And the signs and symptoms of gestational diabetes, we are talking about frequent urination, we are talking of excessive thirst. So you urinate very often and then you become very thirsty. Um, you have blurred vision. These are some of the things that happens with gestational diabetes. And what makes it confusing is that these are also normal signs of pregnancy. So as your fetus, the baby in your womb develops frequency of urination, urinating often and becoming thirsty, these are also normal signs. So it's very difficult to know whether it is you developing diabetes because of your pregnancy or is normal signs of pregnancy. And the only way you could determine the difference is by testing. So We have what we call the glucose tolerance test. So when you are pregnant, they want to do that tolerance test for you. So what they simply do is that they give you a sweet drink, a sugary drink. Then you take it in and they will monitor your glucose level over a certain period of time. When the glucose level is higher, then you are likely having gestational diabetes. So it is a normal test that they do during pregnancy to make sure that you are not having gestational diabetes. Or if you are having gestational diabetes, it can be managed. All right. So that is what happens. So if you do the glucose tolerance test and then you are having gestational diabetes, then you need to protect yourself and protect the baby, because diabetes, when you are diabetic or your baby is diabetic, these are some of the things that happen. One, you are going to have higher birth weight. So you are going to give birth to a baby who is very big. Sometimes it is difficult to give birth spontaneously. What it means that through your natural delivery, okay, it will be difficult because the baby is very big. So you may have to go through surgical procedure, CS, to deliver this baby. Sometimes you could have preterm baby. Preterm baby is giving birth before the full period or the 9 months period. You are going to have this as well, and there could be many other things that happens. And if you have gestational diabetes and it is not properly managed, then even after birth, you are also likely to even have diabetes after that. So it is essential to manage it. How are you going to manage or as gestational diabetes? One of the things that you have to do, I always talk about when I'm doing a video on diabetes, is nutrition. Make sure you are eating well, you are eating balanced diet. When people are pregnant, it is difficult to eat certain kind of foods. They want to eat what they crave for, but make sure that you are eating a balanced diet is going to help you. Make sure you are also exercising. We have pregnancy yoga that you can do, small exercises for pregnant women that you can do. You need to exercise. You need to take care of what you eat. All right, make sure you are eating well, and then you also have to be monitor your glucose level. You'll be given a glucometer in part of the Western world. They will give you a glucometer and then they will show you how to check your glucose every morning. It is very important you keep strict adherence to it. If you are not having the opportunity to check your glucose every morning yourself, then you should be going to the clinic or the health facility regularly to check your glucose and to make sure everything is fine with you. And sometimes, if lifestyle modifications are not enough, your doctors may prescribe medications for you to control or to treat gestational diabetes. Thank you for watching this episode. If you like it, I want you to follow, I want you to subscribe, and I'll see you in the next episode with more. Thank you.